Hey everybody, it's Teal. I'm here to talk to you about the disorder that I was assigned. To start us off, what we're going to do is we're going to play a game. I know you guys have all played this game before. It's called Let's Diagnose with Dr. Google. So what you're going to do is you're going to come up with a quick diagnosis. It can be medical or nursing diagnosis, and then maybe you'll share on the discussion board, or maybe you'll just think about it and think about why am I having you do this, and later on how it applies to this disorder that I'm going to share with you. So you're going to choose one of these case studies, and you are going to come up with either a medical or nursing diagnosis for the person. So pause it for a second. All right, so what did you decide? More than likely, if we were in the class right now, you and your partner would have come up with something totally different than somebody else who had chosen the same exact person to diagnose. That's because this disorder that I'm going to be talking to you about has common symptoms that can't always be explained by physical illnesses. So my disorder is somatic disorder. What we're going to talk about are what is it, the history of it, risk factors, signs and symptoms, treatment, nursing considerations, nursing interventions, and then I have a summary for you to help you study the NCLEX. All right, so first we'll look at the history of it. What do witchcraft, sorcery, demonology, Egyptians, and unexpressed emotion have in common? So historically, somatic symptom disorder was identified as hysterical neuroses, and this is the concept of hysteria is at least 4,000 years old and probably originated in Egypt. So I know that lots of people have talked about hysteria in these presentations, so here we go again. So over the years, symptoms of hysterical neuroses have been associated with either witchcraft, demonology, sorcery, dysfunction of the nervous system, and unexpressed emotion. They've also been historically viewed as primarily an affliction of, yep, you guessed it, women. So this is a picture of Jean-Martin Charcot, and he is presenting his, in this picture it says pet hysteric. Her name is Blanche, to his neurological service at the hospital they worked at in 1887. So Charcot is just describing Blanche to everybody there, and they're all trying to learn exactly what's going on. And you can see the lady kind of behind her. That's us. That's the nurse that's gonna be catching her when she falls. So, and the other picture is taken in the 1920s. And again, they were really excited because now they could actually see the problem inside that was causing the hysteria. And yes, it's the uterus. And so I'm kind of making a joke out of this, but I think it's really important. Even in 2020, it's important for us to realize that women are still at risk, especially women of color, of receiving inadequate medical evaluation for symptoms, all jokes aside. So just a little bit more on this. Freud sort of tried to push it from just women, which people didn't really enjoy him doing that, to the Jewish population, which is not great, and we all know kind of where that went as well. So somatic symptom disorder, what is it? So it's when a person has a syndrome of multiple somatic symptoms. They may or may not be associated with other medical problems. Symptoms are no longer have to be medically unexplained. That's like the new part of the DSM-5, but are characterized by the patient having disproportionately excessive thoughts, feeling concerns about those symptoms. That's part of the disorder. Sometimes the symptoms are normal body sensations or discomforts that don't signify anything, but the person believes that they do. So it's really important to know that the person spends an excessive amount of time and energy devoted to worrying and concern. and that the person is also just completely convinced that their symptoms are rooted in pathology, and they don't believe, and they're often annoyed by the implication that stress or psychosocial factors could be part of their condition. So here's the diagnostic criteria, and it's basically what I just said. But then the piece that I didn't say is the two pieces is there's with predominant pain. Pain is usually involved in somatic symptoms, and it's persistent. So that means that it has to be marked impairment and long duration. So it has to be more than 6 months. And then it's divided into mild, moderate, or severe. And so somatic symptom disorder also has related disorders to it, and I think that it's important to know these for the NCLEX. So somatization disorder is now called somatic symptom disorder. Pain disorder is also part of somatic symptom disorder. Illness and anxiety disorder. This is the one that people were called hypochondriacs. So we know that they are super in tune with every detail about their body. They have fears that any change is a huge problem, and even if they're shown that there's no organic pathology, they may have a racing heart and think they're going to have a heart attack, and their primary fear is focused on the actual fear of illness. Conversion disorder is where somebody can actually, it's neurological symptoms, so they can actually go blind, become paralyzed, or have other symptoms that aren't explained by medical evaluation. And one thing I read said, imagine that you were in a car crash and afterwards you couldn't physically move your legs even though they weren't damaged by the crash. That's what it's like to have conversion disorder. Body dysmorphic disorder, and then facetious disorder is also known as Munchausen's, which you have probably heard of. So here are the changes to the classification. So the DSM-4 to the DSM-5. So again, I kind of already said this, but somatoform and somatization disorder are now clumped into, let's call it SSD. That's easier. So there's mild to moderate, and then severe and persistent. It has to be longer than 6 months. We said that hypochondriasis is now illness anxiety disorder. Conversion disorder has stayed the same, and pain disorder has now been clumped into SSD, but pain is the specifier, and that's going to be really important in diagnosing them. So we're going to actually meet some people who have somatic disorder, symptom disorder, and obviously it's not really these people, they're actors. But there's Matthew, he's an 11-year-old, he has recurrent syncope, and he was asked not to return to school. And then Anna, she's a 16-year-old, and she has debilitating headaches, and she feels like her life is going on without her. And so after we watch like 5 minutes of this, we'll keep talking about clinical manifestations and kind of go on from there.
I know it's hard to look back, but your story may be helpful to others. Basically, if I think back, it started with these like crazy headaches, which was weird because I'd never had headaches before.
What happens is that I pass out all the time. Before it used to happen, like 50 times a day. That's why the principal told me I couldn't come to school anymore.
Can you tell me what your first visits to the doctors were like?
I was going to a lot of appointments, and I went to emergency a bunch of times.
They like sent me for a bunch of tests and like CAT scans and stuff. And what did they say?
They all said it was something different. One doctor said it was a sinus infection.
I was really confused. Confused as to why I was sick.
I knew my parents were really worried that it was something bad. Scared. Scared of what? Maybe I might die or something.
What was your life like at that time? Like the way I see it, my life kind of stopped when I was sick. All I wanted to do was be in a dark room 24/7. Like another thing that I had to accept was that life was going to go on without me. You know, my friends were going to keep going to parties and going to movies together, and they were going to continue to hang out even if I wasn't there.
And what about your family?
My family sympathized with me, but it was really hard to connect with them at that time because no one had been through something like that before. It's not like a cast on your arm that can show people what's wrong. When it's in your head, how are they supposed to know when you're in pain? And so you have to communicate